Hi, I'm Tracy, and I work in the Division of Nephrology, and I just wanted to introduce Dr. Wei-Ling Lau, who was promoted to an assistant professor in July. And so I just wanted to start by asking you kind of what is your current role in the Division of Nephrology?
So I'm actually not new to UC Irvine. I did my internal medicine residency here, 2005-2008, when Norma Hargrove was still the residency director for medicine. And then I went to University of Washington in Seattle for 4 years to do my nephrology fellowship, which I spent a lot of that time in bench research. And I've been back here actually for the past couple of years as an instructor, and just got moved up to the assistant professor level in July, as you said. I actually spend a lot more time working with mice and rats than I do with patients, because 65 to 70% of my time is with bench research. And then the rest of the 30% is spent with clinic, seeing dialysis patients, and doing some inpatient rotations during the year.
Okay, well, we're glad to have you back. So then what is something, or would you mind sharing something about your specialty that most people might not know?
So a lot of people might not realize that looking at a person's urine can actually give you a lot of insight into what might be happening in the kidneys. So for example, seeing certain cells in the urine, or crystals, or what we call casts, which are kind of little debris or sediment just clumped together in the urine, can give us a lot of clues. And interestingly, Disney does rule everything. We actually have a term for one of the red cell findings that we can see in the urine that we call Mickey Mouse, because the red cell, dysmorphic red cell, looks like a Mickey Mouse head.
Oh, wow. I never would have guessed. And then finally, would you mind just sharing something that you've come to appreciate about UC Irvine?
I really appreciate the diversity and the opportunity to, in research, interact with other specialties. So for example, right now I have a collaboration with a professor in neurology and another ongoing collaboration with a radiologist. So it's really great that we have all these professionals in one area to just collaborate with and learn from.
Well, like I said, we're glad to have you, and thank you for taking the time to talk to us.
Yeah, very well.